Welcome back. In case you're just joining us, this is still West on KAFTAN television, and today we have Fatukasi Pelumi, who is going to tell us more on ulcer, the causes and symptoms. Sarah, how are you doing?
I'm fine. How are you too?
It's good to have you join us.
Yeah, same here.
Okay, to begin with, in your own knowledge, what can you tell us about ulcer?
Okay. Ulcer, as people generally call it, the correct medical term for it is peptic ulcer disease, or in short, PUD. And peptic ulcer disease is one of the diseases of the gastrointestinal tract. It is a disease due to a discontinuation in the epithelial lining of the gastrointestinal tract, either due to gastric acid or pepsin. And this peptic ulcer disease could actually have occurred throughout any part of the GIT, but it is mostly found in the stomach and in the duodenum.
Okay, what are the causes of ulcer?
Okay, the causes of ulcer, or if you can say risk factors for getting ulcer. First of all, the most common one is the Helicobacter pylori infection. Then there is also the chronic use of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, usually used by a lot of people to relieve pain. Also, other causes are maybe first degree relatives having peptic ulcer disease, chronic alcohol use, chronic smoking, even post-surgery, some like probably a severe burn, radiotherapy, a whole wide range of things can cause ulcer.
Okay, how many type of ulcers do we have?
Okay, based on the location, we have the gastric ulcer. That is the ulcer that is found in the stomach lining, and then there is the duodenal ulcer. That is the one that's found in the duodenum. That's the proximal part of the small intestine. Based on the duration, we could have the acute ulcer, and then we could have the chronic ulcer.
So out of all these ulcer, which one is most dangerous to have?
Okay, either is not good, but I think the worst type is the gastric ulcer. The gastric ulcer has been proven to progress into cancer. That is gastric cancer. It's usually like it has a higher prevalence of leading to gastric cancer.
Gastric ulcer used to lead to cancer. Can you tell us more about gastric cancer? Sorry, gastric ulcer.
Okay. Okay. Ulcer is like I divided it earlier, it is the discontinuation of the epithelial lining of the stomach. And this is it usually occurs mostly in the lesser curvature. As you know, in the anatomy of the stomach, we have the greater curvature, the lesser curvature, and different parts of the stomach. But the most prominent part, or the easily affected part, is the lesser curvature. Gastric ulcer usually has a symptom, gets worsened by meals. Like most times when people with gastric ulcer, when they eat, that's when the pain gets like worse, it gets exacerbated. Gastric ulcer has a propensity to develop cancer, like I said earlier, and it is more in females. So it doesn't mean that it doesn't occur in males, but gastric ulcer has a preponderance for females.
Okay, what are the damages that ulcer does to one's body?
Okay, for the definition, I mentioned that it is the discontinuation. Usually, an ulceration is sort of like a wearing of something. I don't know if, like, most times in our day-to-day activities, there are a lot of times that we just have, like, probably brush our hand over something. That brings that tearing away of the layer. That is exactly what it is. It's just that this one is happening in the stomach, somewhere that we can't see with our eyes, except with the use of some medical equipment. So this gastric ulcer, when from the causes that I listed earlier, H. pylori, that's Helicobacter pylori infection, can like cause it. And when this Bacter pylori infection. Yeah? Once it is a fecal-orally transmitted microorganism, it is actually a gram-negative spiral multiflagellated organism. And this organism, this microorganism, what it does is that it burrows into the epithelial lining of the gastric wall, of the gastric mucosa. And then once it burrows here, it enters into the wall. And in doing this, it makes a channel for the normal acid that usually like made by the stomach to help in digesting food. It makes this, it gives room for this acid to enter into that hole that it has created. But Helicobacter pylori by itself has a lot of protective mechanisms for the acid not to affect itself, but it doesn't protect the human body. It makes us like have the symptoms and the clinical features that usually affect you. Also, I talked about NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs. These are drugs that most people take to relieve pain, and but a lot of people they tend to take it like a lot. And chronic use, that is prolonged use of these drugs, lead to inhibition of actually the mechanism of action of NSAID is the inhibition of cyclooxygenase and prostaglandin H synthase. And these enzymes, they are usually like they usually help to make some chemicals or so to say in our body, such as prostaglandin E2, that is needed for and some nutrients that is needed for the stomach blood flow to be okay. So with the combination of let's say also smoking increases the risk of gastric ulcer. So if you are smoking does like for a
Okay,
long
if,
while,
if
you
if
have like
someone
a
is
higher.
smoking, there's possibility of them to have gastric ulcer.
Yes, yes, more of gastric ulcer than even duodenal ulcer. Also, chronic alcohol use, like taking alcohol, like some people take it like a lot. Also, in some conditions such as like some people they get exposed to burn injuries, severe burn injuries. This can lead to like a cutting off of the blood supply to the epithelial lining of the stomach. All this boils down to causing gastric ulcer, which is the ulceration of the epithelial lining of the gastric mucosa. And the features, that is, how do I know? Like, let's say, how do I know if I have gastric ulcer? There are some signs and symptoms that usually accompany it. An example is abdominal pain. That is what we usually call stomach pain. Actually, this particular stomach pain is usually localized. That is, it will be in the middle part, like that upper part of the stomach, yeah, of the abdomen. That middle part of it, that's where the pain is usually like severe most. Some people can have things like heartburn. Some people refer to it like heartburn because like that's the way that they used to describe it. Sometimes there can be nausea, that's the feeling of wanting to vomit, or at times the person can actually vomit. At times there can be dark stool, that is some when they go to the toilet, they notice that their stool is actually very dark color. This actually shows that there's like some sort there's already bleeding, because you know I mentioned earlier that the lining of the mucosa, for example, if it is by the H. pylori, once it
Yes.
burrows into the lining, you know, it will injure the lining now, and then the blood vessels too will be injured because usually there are blood vessels supplying this lining. So once this is injured, there's usually some sort of bleeding. So this bleeding, it could either be vomited, and let's say, I mentioned earlier that they can be vomiting and nausea. So the vomiting, it's possible for the person to vomit blood. It might not be a whole lot, but at that process is called hematemesis. Also, the dark stool, as I was saying earlier, the blood, once it gets to the lower, it comes out with stool now. It would have been denatured by the different enzymes in the GIT, and then it gives the stool a dark color. The stool can also is like it's very black and foul smelling. Also, sometimes people can feel like they are always full. Like some people they eat just a small, like small food, like small quantity of a small portion, and then they will start feeling very full already, and that is called like bloating. There are some features, or there are some signs and symptoms that are like alarm features. Like once you see this, you need to take rapid action, because we Nigerians most times we have this attitude of this thing just there my shame to go. Especially for people that don't really have the duodenal ulcer,
Yes.
that And then once they eat, it will go away now. So they feel like, it's fine. But for the gastric ulcer, which is very like the worst counterpart, once they eat now, the pain even gets worse. So probably people like this, they will be pushed to go into the hospital. But for people with duodenal ulcer, they tend to just stay and just rest on that things. Once I eat, this pain will go now and all. But there are some alarming features that once somebody sees, you are supposed to know that this thing is already getting out of hand, and you should rush to the nearest tertiary center that is available. Example, like once you start noticing unintentional weight loss, like you know that you know like I'm trying to lose weight, but you just start feeling like my clothes is not sizing again, I'm already losing weight, or overt GI bleeding. Like let's say somebody is vomiting now and then you can literally see frank blood, a lot of blood in the vomiters. That is a red flag. Also, there can be recurrent vomiting because I mentioned earlier that one of the signs and symptoms of this ulcer is vomiting. So once the vomiting has gotten out of control, that the person is vomiting for like probably 5 times, 10 times, you should know that you should rush to the hospital because that is giving room for dehydration and that can lead to like a medical emergency. Also, if there's anybody in the family that probably a close relative, probably the mother, the father, or even like an uncle, auntie, or grandmother, anybody that has like an history of upper GI malignancy, that's upper gastrointestinal malignancy. So these are like the red flags that are to be noted. And once these are seen, once you rush to the nearest tertiary center, if you feel like you have been managing it by yourself and you are like, it's nothing big. Ulcer is actually something big. And if remedy is taken like fast enough, it can be cured.
Thank you very much. You know, what is more common about ulcer is people used to say if you don't eat regularly, there's possibility of you having ulcer. Is hunger part of the cause of ulcer?
Hunger is actually not a part of the cause of ulcer. Like I said earlier, there are different kinds of ulcer. That's the duodenal and the gastric ulcer. Usually, yeah, for somebody with duodenal ulcer, once the stomach pain comes and the person eats, the pain usually like gets relieved. So I feel this is, and the duodenal ulcer is actually the most common variant of the ulcer. So I feel like that's probably why people attribute probably you know that guy have ulcer. Not if it doesn't have doesn't it's not a cause of ulcer, although it's able to exacerbate somebody that already has it.
Can ulcer be cured permanently?
Ulcer can be cured permanently. It's, that's basically depends on the cause of the ulcer. And really, I feel all ulcers can be cured permanently as far as it is yet to progress into cancer, obviously. So, I know some cancers can be cured, but to a very, very large extent, peptic ulcer disease can be cured.
Thank you very much, Pelumi. Let's quickly go and talk on health benefits of watermelon. We'll be right back. Welcome back. There you have the benefit of watermelon, and we are still in the studio with Fatukasi, Pelumi, and we are still discussing ulcer. Thank you so much for staying with us, Pelumi.
You're welcome.
What are the things that you think ulcer patients should avoid?
Okay. Usually, based on the cause of the ulcer. Let's say, for example, a person that usually takes NSAID, that's like all these painkillers. Yeah, people call it painkillers. All these painkillers like frequently. The first thing they should avoid is taking painkillers like as frequent. Don't take painkillers like unprovoked. Like some people just anytime they have like little pain, they go to the nearest chemist and go and ask for I'm feeling body pain, and then the people there will just sell these myriad forms of like painkillers for them and then they use it. This is actually one of like it's already becoming like a very prominent cause of ulcer now as opposed to the Helicobacter pylori. Also, another thing that people should do to probably prevent peptic ulcer disease is to make sure that they maintain good food hygiene. Like we should make sure that whatever we are, wash your hands, prepare your food properly, and cook the food well. This helps to like destroy the H. pylori. And there are some food that usually exacerbates the pain of ulcer. There's one of my friend, again, she said that if she takes food cooked with tomato paste, it exacerbates her ulcer. Fried foods, carbonated drinks, just a whole lot of things. For people that take alcohol, I think you should really cut down on the alcohol intake, or if possible, stop taking alcohol. For smokers, quit smoking. Smoking doesn't really have any positive side. Majority of the effects of smoking are negative. So cutting out smoking is like a major way of preventing this PUD.
Talking about food, which food do you think is recommended for someone that is living with ulcer, and which food should they avoid?
Okay, people that have ulcer, they should avoid taking carbonated drinks. They should avoid taking food cooked with tomato paste, fried foods. They should avoid those a lot. Peppery food too, because once the ulcer is formed, it's sort of a wound now. And even outside our body, once pepper comes in contact with the wound, we don't feel comfortable. So they should avoid taking a lot of pepper because these are foods that can like exacerbate the pain. But depending on the cause of the ulcer, let's say for example the cause of the ulcer was Helicobacter pylori, which can be eradicated via some regimen of drugs. So once the treatment is completed and the person has abstained from all the exacerbating factors of the ulcer, then the person can continue living their life normally as they usually do.
How do you diagnose an ulcer?
Okay, there are different methods of diagnosing ulcer, but the gold standard, according to WHO and the that's World Health Organization, is upper gastrointestinal endoscopy, and it's like a tube that usually passed via the mouth and then to the stomach, and it has a camera used to visualize the whole GIT, and so that you can see. And then in some cases, in biopsies, and then they can take tissue for biopsy. Other tests that are non-invasive, we can do the H. pylori assay. There are serology tests, that is where the blood is drawn to take tests, and these are used to like the serum can be used to detect the antibodies against H. pylori. Also, stool antigen tests can be done, whereby the patient is asked to bring a stool sample, which is evaluated to detect the antigen of H. pylori. Also, abdominal X-ray can be done, because in cases of some complicated ulcer that are already perforated and all, this can be caught. Or some eye resolution X-rays, so you could be able to visualize some of the damages that are around the GIT. Also, a CT scan can be used. The C-urea breath test can also be done. There are like a whole lot of tests that can be done depending on the hospital or the facility that the patient go. Then the appropriate test and available test will be done to properly diagnose the peptic ulcer disease.
Okay, are there things that heal ulcer faster?
Okay, first of all, every treatment is usually based most times on the cause of the disease. So now let's say for example, the cause of this peptic ulcer disease, let's say the patient, for that particular patient, the cause of their own peptic ulcer disease is H. pylori, that's Helicobacter pylori. So the method that is used to cure this kind of ulcer caused by that microorganism is a regimen called the triple regimen or the quadruple regimen. In the triple regimen, a proton pump inhibitors, for example, omeprazole, rabeprazole, pantoprazole, there are a lot of varieties of proton pump inhibitors. One of them is used at a high dose and also in conjunction with drugs such as some antibiotics such as clarithromycin, as well as amoxicillin or metronidazole, commonly known as flagyl. So the combination of these three drugs makes up the triple regimen. Also, the quadruple regimen, apart from these three drugs that I've mentioned, the quadruple regimen, bismuth sulfate is actually used also as to make up the quadruple regimen, and this usually is able to cure the is able to destroy the organism, the microorganism, and then the ulcer can heal, and then the patient can be okay. But let's say, for example, because of that person, let's say because of that particular patient's ulcer is probably alcohol, chronic alcohol use, then it will be advised that the person stops taking the alcohol and give the body room to heal. Also, if chronic use of NSAIDs is what's causing it, then the person will be advised to stop taking NSAID, or at least you can use other pain relievers that are not non-steroidal or steroidal anti-inflammatory drugs. Also, for if the person smokes, the person will be advised to stop smoking and so on and so forth.
Thank you. Is it possible for someone that has ulcer to have a sleepless night?
Definitely. Um, For the duodenal ulcer, I mentioned earlier that the ulcer is usually like relieved by eating. Most times, these people that have duodenal ulcer, because they have already noticed their body that once they eat, the pain goes. So usually, what happens is that once the pain comes, the next thing they want to do is to eat food. So at times, or most times, really, the stomach is like most times the GIT and all of them, they're usually like active during the night, and a lot of secretions are taking place even while we are sleeping and all. So the wound that is already there gets more like the acid gets to act more on this already like eroded area, and then it causes pain, and this pain will wake them up, and once they wake up they will have to eat before the pain will go, and then after the pain goes then probably the person can go back to sleep. And so it's definitely possible for somebody that has PUD to have sleepless nights.
Okay, we talked about food. Then I think we should talk about drinks too. Definitely, we know that taking of alcohol is not advisable for someone that have ulcer. Then, is it? Let's talk about, is sugary drinks better for someone that have ulcer, or what type of drink should they avoid, and what type of drink should they drink? Should they take?
Okay, basically, apart from alcohol, carbonated drinks, for example, Coke, Fanta, all those majority of drinks out there, they are like carbonated because all those sharp energy drinks and all of that. Somebody with peptic ulcer disease should not or should at least avoid taking those drinks. If a person has peptic ulcer disease, you could go for fruit juices, like you can take juice instead, actual fruit juice, not all these fruit drinks. You could take probably some yogurt, basic drinks, or yeah, that's just, or you can drink water, stick to water. Water is life, water is good. You can drink water too. But all those carbonated drinks, alcohol, energy drinks, they are known to exacerbate ulcer pain and also like increase the progression more or less.
And then, what advice do you have for people that has ulcer?
Okay. My first advice would be that please, once you start noticing any change in your body, like from some of the symptoms, apart from even ulcer, literally once you start noticing your body giving you signal that something is going wrong, the first thing you should do is to go to the hospital and get treated. Talk to a doctor, let them evaluate you and give you the proper treatment. And peptic ulcer disease can be cured. So, but it is leaving it to like stay long that can lead to something big, like gastric cancer. Gastric cancer is not child's play because usually a lot of people die. Like it's one of the high mortality cancer. So I feel if somebody can like they say, prevention is better than cure. So avoiding things like for people that don't have it already, avoiding things that will cause it. I would advise you to do that. Don't take alcohol. don't take, or too much alcohol, like chronic smoking, don't, what, good food hygiene, even generally body hygiene, but good food hygiene will go a long way to prevent people from having peptic ulcer disease, and that's basically it.
You join us on Health is Wealth today.
Nice to meet you guys.
Hope you will join us next time too.
Once I've chance.
Thank you. And for our viewers, if you feel any discomfort in your body, even if you have headache, go for a checkup. Don't just stay at home and feel like, okay, if I rest a little, the headache will go. If you are feeling any discomfort, just go for a checkup so that they will have a thorough checkup. They will check you up and know what exactly is wrong with you. And if you have ulcer, ulcer is not the end of the world. Trust me. Just take your medication regularly and everything will be fine. And that will be all on today's episode of Health is Wealth. See you again next time. I am Yetunde, Alanamu.
Yes, there is news on your device, but hearing an analyst's perspective is the icing on the cake that Daybreak Africa provides. Break. Start your day with prompt analysis of the latest news, trends,
exactly, and then you see these people, they are so agile, they can do a lot of
politics.
We have to go back to that regional system. That is the foundation of this country, for God's sake.
Entertainment, fashion, culinary skills.
So first I'm going to be pouring the oil inside the pot, and I will...
religious and cultural events amongst others on Daybreak Africa.
For a rich mix of analysis on current issues, tune in daily from 7 a.m. to 9 a.m. on channel 480 and 124 on Startimes.